Sorry, I believe my mic was off. Good evening and good morning to those joining us from different parts of the globe. Welcome to the July edition of Autism Face Yoga. Today's topic is Autism, Face Yoga and Acupuncture. And with us are two amazing speakers, Dr. Vaishnavi and Dr. Tritankar, who will be joining us. Welcome and thank you for joining us today. So once we complete our 10 minutes capsule, we are going to hand the floor over to them, and they're going to break some of the misconceptions that we have about acupuncture for therapy, and very interestingly, acupuncture for beauty. So let's just quickly continue, and then we're going to go back. I'll introduce them and hand the floor over. Okay, we'll come back to you. Okay. Face yoga. These are a series of asanas or exercises for all on the autism spectrum, caregivers, family, and friends. The exercise regime using the 57 muscles, the facial muscles, that is the face, the neck, and the scalp. Yes? Do you remember? So can we say the face yoga? Yes? What do? You smile, and as you say yes, you stretch the corners of your mouth. Yes. Perfect. One more time. Smile and yes. Some of us might need some help. So place your fingers at the corners of your mouth or their index fingers and stretch their corners of their mouth, asking them to say, yeah. And relax. One more time. Place the index fingers on the corners of their mouth and yes. Relax. So welcome to those joining us presently. My name is Minal Potnis. I'm an evangelist in Asia of the face yoga technique for wellness, mental health, integrated medicine, autism. A revolutionary exercise program, standardized exercises using research and a mind approach. It's raining, and what we would like to do is quickly complete our capsule, and then we're going to go to our today's speakers. So let's start. Yes? What do? Yes. And relax. One more time. Yes. Relax. Take your index fingers, for those who need help, place them in the corners of their mouths or place their index fingers and stretch. Yes. And relax. What are we going to do next? A little warm up, the sniffing. So, like a rabbit. Okay? Okay? What do? Wrinkle your nose and sniff. Hold the position, relax. Wrinkle the nose and relax. Somebody needs help, ask them to scrunch their nose. Hold it for them if you like. Just hold the position and relax. Again, as though they're going to sneeze. So ask them to, get ready to sneeze. Hold the position and relax. Good job. Take your fingers and just tap, tap, Tap. Tap the back of your head. Tap the front of your head. Tap the side. On your ears. Back of your head. On the scalp. Tap. Relax. And now, let's help those who need help. Take their fingers or take your fingers and play the drum on their head. Yeah? Little forceful, but not that hard. Yeah? Perfect. Doing good. We've been doing this for nearly a year now, and you should be very proficient with it. Good job. Now, the orbicular oris. So open your mouth. Ah. Hold your lips over your teeth. Hold the position. Hold the position. A nice round O and relax. One more time. Open your mouth. Ah, really loud. Ah. Now fold your lips over your teeth. A nice round O. Hold the position. Hold the position and relax. And now somebody might need help. So what I want you to do is open your mouth, hold the position, just hold the position, hold the position. Hold the position and relax. Now let's help somebody who needs help. Open your mouth, hold your lips. So somebody needs help. What are you going to do? We're going to ask them to open their mouth, right? Hold their upper lip and their lower lip. Open their mouths wide and just hold the position as wide as you can with your fingers, with their fingers. And relax. So let's try it once more. Open your mouth, open their mouths in this case. Hold their upper lip, lower lip. Just hold position and widen the O as much as you can. And relax. Good job. Good job. Similarly, now we're going to do the jaw. So you're going to open your mouth really wide. Hold your lower lip over your teeth. Hold the position. Hold and relax. Open your mouth. Fold. Hold the position. Yes. Yes. And relax. Good job. Now let's help somebody if they need help. Ask them to open their mouths really wide. Fold their lower lip and hold it tight. And keep their mouths open. Hold. And relax. Good job. One more time. Open their mouths. Ask them to open their mouth. Hold. Hold the position. Make sure that jaw is lowered so that the mouth is nicely open. And hold. And hold. And relax. Good job. Now, Just sit straight and look up. Doctor, if you're online, you can please open the video. You're most welcome if you're online. So sit straight, look up, hold the position, and relax. Okay? Straight, look up, look to the ceiling, smile, keep smiling, and relax. Good job. Sit straight, look up, hold the position, look up, smile, and relax. So, ask everybody to hold up their hands and then look up. Okay, look up. Excellent. That was good. That was interesting. Now, the balloon. So, take air. Hold the position. And relax. Again, take in a lot of air in your cheeks. Take 3 fingers and place them on your lips. So repeat. And keep breathing. And keep breathing. And relax. Again, take air into the buccinator. And keep breathing. And keep breathing. And relax. Good job. Somebody need help? What do you ask them to do? Ask them to blow air. And then take 3 fingers, their fingers or your fingers, and just place them on their lips and ask them to just hold as long as they can. Just hold. Just hold. Just hold. And relax. Fine. Ask them to do it. And then place their fingers or your fingers on their lips and keep breathing. Keep breathing. Excellent. Good job. And now we're going to do the yes, right? Because we like to say the yes. So yes, but this time I want you to really pull the corners of your mouth like this. Yes. And stop at your earlobes. So corners of your mouth, stretch and hold. And hold. And hold. And smile. And relax. One more time. Corners of your mouth. And yes. And hold. And relax. Good job. And now, again, what I want you to do is, I want you to look at the ceiling, but I want you to say yes. Simple. Look up. Yes. And relax. One more time. Looking up, looking good, looking sharp, and yes. And relax. One more time. Looking up, hold the position, get ready. Yes. Stretch, really stretch. You can do it. Look up, eyebrows have to go up. Look up, smile, say the yes, hold the position, and relax. Now, if somebody needs help, ask them to look up to the ceiling. Keep looking up and then just ask them to say yes as you hold the corners of their mouth and stretch. Yes. Good job. That was nice. Fast, quick, and it was a refreshing workout. Now we're going to invite our guests, Dr. Vaishnavi and Dr. Tritankara. I believe they will be joining us in a second. Till then, nice. Goodbye.
Hello.
And thank you for joining us. It's raining. It's raining. Yeah. So it's like here right now. But I guess that's always nice weather. Okay, before Dr. Vaishnavi DA has
Yes,
completed
ma'am.
your education by ASA University, Bangalore, right?
Right.
And
Vyasa
what,
University.
what did you do there? You completed your master's?
I have completed my master's and bachelor's degree in naturopathy. So I passed out in 2019.
Okay.
Yeah.
And you've been now
And
practicing for the last 6 years as well, right?
yes,
6 years.
ma'am. Yes.
Yeah. Wonderful thing. And at such a young age, he is also the HOD of the Department of Acupuncture. And very interestingly, as we hear from both of them, they've been handling a lot of different cases in neuroconditioning and other aspects under acupuncture therapy. But before I say the last and the interesting point, let me also ask Dr. Roy. You, I believe, have passed out of BNYS
Yes.
college. Is that also located in
Shobhit
Bangalore?
University. No, no, it's located in Uttar Pradesh.
Oh,
Hello,
wonderful.
am I audible?
Two different aspects. And I
Yeah.
believe acupuncture and traditional Chinese systems is what has been your interface or focal point, right? A lot.
Yes.
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 The both of them have doctors in the family, but per se, both their fathers are have an expertise in acupuncture, and that has led them an incline to this particular field. Am I correct, Dr. Vaishnavi and Dr. Rai? Right?
Yes. Yes.
Yes.
Yes, ma'am. Yes.
And now, interesting fact, especially, is both of them, besides, of course, the various requirements for acupuncture in various treatments, they both have very interesting incline towards cosmetology or acupuncture for beauty. And I'm going to ask them to talk about it subsequently. So, with this, I'll hand over the floor to you and to take on. Therefore, I have only two questions that I had listed out. Of course, we would like to know about acupuncture and the misconceptions that, oh, it's a very painful treatment. But I would also like to
Right.
just have one specific thing: is can acupuncture affect help affect the brain in any condition? And what is neuro acupuncture? But I will leave it to you how you would like to flow, and handing it over. Want to switch off the?
Sure. Sure. We'll include all those questions answers. Uh, okay. Thank you, ma'am. Okay, we'll start. Okay. Hello, everyone. We'll be talking about acupuncture therapy. So there are various methods we use acupuncture in the modern aspects also and in traditional aspects also. So first of all, we'll talk about the definition. What is acupuncture? What does it mean? So acupuncture is two Latin derived words. Accus means needle and puncturized to puncture. So we use here very fine needles in acupuncture. We'll be inserting into the body and for various disease conditions. So first of all, we'll talk about three things. What is acupuncture? How does it work? And why? So the second one is how does it work? So when we are inserting fine needles into the body, it activates nerves. Nerves will and it sends impulses to the brain. So brain will activate. We have a gland called hypothalamus. In that pituitary gland will release a few hormones which will make our body relax. So there are natural body's painkillers which are called endorphins, neurotransmitters, dopamines. These are happy hormones also and stress releasing hormones also. So this will be released when we insert needles into the specific points of the body. So the third thing is why we should take acupuncture. So it is very simple, handy. The most important is painless therapy and natural therapy. As we know, acupuncture is a very traditional therapy. It is used in India. 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 It is us
Continue, doctor. I'll let you. The signals are going, so I just switched off.
Okay.
Go
They are
on and
audible?
please tell us. Yeah, you're very audible
Okay.
and you're very clear. Please go on.
Okay.
Doctor, tell us about. We're of course talking about autism and face yoga, but I'll leave it to you.
Yes. Sure, ma'am. Sure. Okay. So the third thing we were saying about why we should take the acupuncture therapy. First thing is it is a natural therapy. It has no side effects. Simple, effective, safe, and economical. And it's not even time consuming. And for a longer term, we use acupuncture in various diseases like neurological conditions. So there are various disease conditions like hormonal imbalance, neurological conditions, pain management like musculoskeletal disorders. And so we have covered many diseases here. In hospital, we are treating many diseases of neurological conditions such as Parkinson's, autism, stroke patients. We have seen good results in acupuncture. So we have been using modern acupuncture also and traditional Chinese medicine also. So right now we are looking forward to traditional Chinese medicine. So I'll hand it over to the Tirthankar about talk about.
Hello everyone, am I audible?
Yeah.
Yes. So traditional aspect, we learned that what is acupuncture and how does it work, and what our ancients think about acupuncture, how they created acupuncture.
Tirthankar, little louder. Dr. Vaishnavi was very strong.
Now, is it okay? Okay. So our ancients found acupuncture in a process called trial and error method. They tried in various of body parts. That's how acupuncture points created. And after that, there was some theories called Taoism, Yin and Yang theory. Then there is five elements. Now I'm going to talk about a simple theory that's called five element, which in India are called Panch Mahabhuta. And same theory found in acupuncture called five elements. Five elements is a basic theory where our 12 body organs was divided in five elements. There are different seasons, there are different tastes, all which are divided into five specific elements. We found some symptoms about that elements and then we treated it. Like when it's winter and we are we have a viral fever or something like that, we're going to treat the water element because it is the base element for winter. And that's how our ancients created five elements. After that, there are many methods of acupuncture like master tone, which we use in a mirror image. Like if we have a pain in knee, then we'll treat the elbow. We created mirror imaging method. Then there are some ashi points, like where is we put needles where the pain is. And it is also an effective method, a modern method, ashi points and ashi method. And there is eight principles, like there are principles like if there is damp, there is acidity, there is so eight principles. We find symptoms of that principles. There is heat or damp or cold. We found those symptoms in a person and we treat them with those conditions, with the specific point. And for the question, the ma'am, what is neuroacupuncture? It is basically all the acupuncture is neuroacupuncture because we are treating the central nervous system or the peripheral nervous system. We are treating the nervous system because we can only create one stimulus, and other stimulus we can't create. There is only one stimulus we can create, that is pain. We can create a micro injury with a fine needle, and then that stimulus, that pain stimulus, will go to the brain by long fiber and short fiber tissues, and then brain will secrete some hormones, and that will treat. That is the modern aspect. In the traditional aspect, we see the body as a whole. Like if anyone having two unrelated symptoms, like someone having a abdominal pain with a neck pain. Two are the complete different symptoms, but we treat him or her like it is the one. We'll find the interrelating factor, and then we'll treat him like it is a whole body. We're treating. We're not treating him like not only for neck pain or abdominal pain. It is the traditional aspects of the acupuncture. And for the facial acupuncture, it is very popular now. It is called cosmetic acupuncture. It is very popular because without any side effects, without any cosmetic surgeries, without any medications, we can reduce wrinkles, we can reduce facial fat, any blackheads, and many more things. Some of the cases show that it can regrow the hair, so hair fall comes under that. Cosmetic acupuncture basically will use cosmetic acupuncture with some modern aspects. Right now, we are using. We'll cleanse the face, then put some needles on the face. We'll mark the points where we have to put the needles, and those needles are different from the normal acupuncture needles. It's much smaller, much thinner because it goes in the face. So it is called the micro needles, and we treat some cases of Parkinson, autism with the scalp acupuncture. Scalp acupuncture in the scalp, and of course hemiplegia. Hemiplegia has a great result. In hemiplegia, acupuncture has a great result in a scalp acupuncture. We put some needles in the scalp in a motor region, and then the scalp needling. There is a place called motor region. There is sensory region. There are various places in the skull. We use needles, fine needles. We insert it, a complete needle in the skull. It is of course painless, and after that we tell him or her to walk. Like we'll give them a continuous stimulation for 20 minutes and tell them to walk in a manual stimulation. We'll stimulate the needle, and after that
A
there is
question. This can be used for children also. The scalp acupuncture therapy for children also.
yes, yes,
You are
yes,
using it
yes,
for
we can.
neuro condition.
Yeah, we can use the scalp acupuncture. There will be much finer needles for children, and we'll use some distal points also. According to five elements, we use some distal points. According to TCM, the traditional methods, we'll find some distal points for the body, and we'll use the skull acupuncture to for the systematic relief. Yeah. And then there is another aspect of acupuncture is acupuncture anesthesia. It is very popular right now because it really ensures the painless delivery. So
It's being used in India
the,
also, or it's only is it
yeah,
being
yeah,
used in
yeah,
India or yeah?
Yes,
yeah.
Very
we
interesting.
have
Okay.
started.
Yeah. Okay.
Some of the doctors are doing acupuncture anesthesia, and they have great results. Of course. Acupuncture anesthesia work in a painless delivery, like after conceiving the baby, after conceiving the fetus, for like 6 to 7 months, we give them normal distal point acupuncture, normal needles, normal acupuncture. When in the time of delivery, we use some specific points to release some of the hormones which are called painkillers. some of the homeostatic points, like which balance the point, balance the condition, like that, and the point of autism. Autism, we can ensure we can give autism patient is basically most of the autism patients are neonatal. So
Okay. Continue.
congenital
Continue.
disorder, congenital disorder, and it is the case of neonatals. So there is a few aspect we can use acupuncture, like in the speech, we can give him or her the patient some speech points, some of the skull acupuncture, some of the
We can try to improve symptomatic relief. Like they will not respond to you quickly, or many symptoms are like developmental disability disorder. It is right. They will not even talk to you or respond to you in any way. They will not even play games with other children, or they will not respond to any perception, whatever you are asking. So we can help them with all little symptoms. Like we can help them to improvise their well-being or their lifestyle, everyday lifestyle. We can try to improve with the acupuncture. So we can give for autism we can give cosmetic acupuncture also. So that will help them with facial muscles also. It will activate. Yes.
and some of the points for vital energy.
Mhm.
Because we are practicing energy medicine, so there is a deficiency of vital energy. That's why in the TCM definition, if there was a deficiency of vital energy, then these conditions happen. These conditions occur. So we'll give him some the homeostatic point, which are the balancing points, and some points for regaining the vital energies or improving the vital energy. And acupuncture will help in those conditions, like for alternative method, not in a not in a proper, not in a main therapy way. Okay. So in an autism patient, we can't see verbal or non-verbal communication. In acupuncture, in my experience, there are some points which will improve that verbal or non-verbal conditions. They will interact with you after few sittings. After few sittings, they will interact with you. There are different types of sittings we plan on the condition of the patient, like the severity, the age, while with the some alternative some extra factors, like with autism, in the cases not only autism comes there, with some extra factors will always be there, so we'll treat them accordingly, we'll plan the sitting accordingly.
Okay.
So typically, you would need what, at least 10, 12 sittings spaced out, or at least 3, 4 sittings initially
No,
with the
no,
child, if you're talking
sometimes
about an autistic child.
not that. Sometimes we can plan 12 continuous sitting. Then we'll space out for like 7 days, and we can
Okay,
plan a sitting interval of 5 days or 7 days. We can plan that.
you can plan it
It's
out.
depend on the condition of the patient on the case.
Correct. Then I have a quick question. You just mentioned that the needle, whatever, is for 20 minutes, but that period can be extended instead of 20 minutes. Can it become half an hour, 1 hour,
Yeah,
depending on the severity,
it,
or that is not the
No, no,
correlation?
not 1 hour. Why we choose 20 minutes? 20 minutes is the condition. 20 minutes we choose because after 17 to 18 minutes, our body works like tonification. Those
Ah,
acupuncture points work like tonification points. When we want to improve the vital energy, we use 20 minutes. After 20 minutes, it work like
It is
seizure.
very simple that if you give anything exceeding the limit is dangerous to health, right? So on that specific point, it energizes. Energy will be improvised there. Energy will be increased. If it is in excess, again that will be toxic. So that is a simple theory. What even if you give current on the body for more than 20 minutes, that will obviously numb your veins, numb your
Correct. This is
muscle of that.
okay.
So
Yeah,
it's
so
the
I was just
same way.
wondering the thing.
Yeah, correct.
No, we use
Please,
some
please.
another stimulation like electrostimulation, where we only use those stimulus for 20 minutes, because after that they will numb the body. And even we don't use electrical stimulation, it can be except to 30 minutes, not more than 30 minutes, because 30 minutes is the time for sedation.
And I think you had mentioned needle points in the head, and so all these can affect the brain, right? It can enhance whatever the sluggishness,
Yeah,
etc. of the brain.
every acupuncture
Acupuncture.
points, every acupuncture points, yeah,
Yeah.
every acupuncture points affects the brain, because uh, when we put a needle
Yeah.
inside a body, it creates a micro engine. Just like man
Ah,
said, it creates a micro
right.
engine, and there will be some hormone releasing factors.
Yes.
There
Yes.
have to be some
Okay.
hormone releasing factors. So
Wonderful.
It
And
works as a
this
pain
would be
therapy.
okay. And this would be
Yeah.
this is called neuro acupuncture because it's part of
Right.
the
Right.
yeah, yeah,
yeah. Because
Acupuncture
all
is
of us are
basic therapy. Yeah. Yes,
no,
ma'am.
no, no. Please don't. Please. I'm sorry.
No, no. I was just talking about that if you insert a needle, that will stimulate nerves. It basically works on nerves. So it is whole neurological. Neurological. It is complete. It covers neurology. Right.
I think you've covered this entire thing in a nutshell. And the myth is that acupuncture hurts, so let us not go near it. But I think you just mentioned there are
okay,
different ways in which
there are many myths. Actually, there are many myths like acupuncture. When we put a needle in a point that creates pain, so we forget about the pain which are there before. So there are many myths like that. Like don't use needle. We can't use needle. We don't absolutely we don't use needle because that there is some cautionary factors. It the pain factor that it creates pain.
We have
Acupuncture,
a few layers on skin. So first layer if you pass out, then later on it will not pain. Only when there is a skill to the acupuncture. If you prick it properly, the
yeah.
first few seconds it will pain while
yeah.
pricking. Once it goes into it will not pain.
But doctor,
Right.
I
Right.
with you, of course, both of you, but with you, it's like nothing. There is no pain. However deep it goes, whether it's on the thin layer of the face or it's on a nice fleshy layer.
And there is a diameter factor in the needle. The needle diameter is as thin as here. So uh, there
That is also a benefit. That is why we can use so many needles on the body. It is very fine needles. We have needles available here. We'll show you. You can look at it comparative to injection. It is very fine needle. You can't even see. See,
Yeah,
can you see it?
this barely
Yeah,
I can take.
it's just like hand. Yeah, and it is negligible to the body. That's why we can prick so many needles and we can prick it on the body, and you won't feel it like an injection.
Wonderful.
Yeah.
So with this, we've got a good overview of all aspects, and thank you for joining us today. We definitely like to know a little bit about cupping that you were talking about that at another stage. And with that,
Yes.
I once again, and we hope to see you soon. Yeah,
Thank
and
you
this
so
thank
much,
you.
ma'am. Thank you for having us. Thank
Thank
you.
you.
with
Thank you.
this, say and conclude today's session. We will meet you next month, same time, same place. Bye bye. Take care.
Okay, bye bye. Thank you.